suppressor gene, TP53, gene name TP53, gene product, P53 protein, function stops the cell cycle at G1 S phase by activating P21, which inhibits cyclin CDK complexes. Also promotes DNA repair, senescence, and apoptosis. If mutated, damaged cells can continue dividing, cancer risk. Associated with most cancers, commonly mutated tumor suppressor. Li-Fraumeni syndrome, inherited TP53 mutation. SBLA, sarcoma, breast, leukemia, lung, adrenal gland tumors. Early age onset, multiple cancers in one family. USMLE, question 1. A 5-year-old girl is brought to the clinic after developing a rapidly growing soft tissue mass in her thigh. Family history reveals her mother had breast cancer at age 28, and her grandfather died of adrenal cancer in his 30s. A germline mutation in which of the following genes is most likely responsible? A, NF1, B, BRCA1, C, RB1, D, TP53. D, TP53. This is Li-Fraumeni syndrome caused by a TP53 mutation. Look for multiple cancers in young family members. Why not the others? A, incorrect. NF1 causes neurofibromatosis type 1, not this pattern. B, incorrect. BRCA1 mutations are mostly linked to breast and ovarian cancers. C, incorrect. RB1 is linked to retinoblastoma and osteosarcoma, but this case shows a wider cancer pattern. E, incorrect. PTEN causes breast, prostate, endometrial cancers, not adrenal or sarcoma. USMLE question 2. In a normal cell, P53 is activated in response to DNA damage. What is the primary effect of P53 on the cell cycle? A, activates telomerase to extend cell life. B, stimulates cyclin D to push G1S transition. C, activates P21 to halt the cell cycle. D, enhances RAS signaling for repair. E, triggers VEGF to promote angiogenesis. Correct answer C. Activates P21 to halt the cell cycle. P53 upregulates P21, which blocks cyclin CDK activity, arresting the cell cycle to allow for DNA repair or apoptosis. Why not the others? Incorrect. P53 does not activate telomerase. That would promote cancer. B, incorrect. Cyclin D promotes G1S, but not P53 inhibits, not stimulates it. D, incorrect. RAS signaling is not directly affected by P53. It's more related to growth signals and NF1. E, incorrect. VEGF is involved in angiogenesis, regulated by VHL, not P53. Let me know if you want the next tumor